Hello, my dear friend. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons from real cases we see every day. Behind many serious illnesses is a process that develops quietly long before the body finally begins to struggle. And today's topic focuses on one of the most overlooked systems in the body, the kidneys. Most people only think about the kidneys when dialysis is mentioned, or when the swelling becomes severe, or when the weakness becomes overwhelming, or when walking becomes difficult. But kidney failure rarely begins at that stage. It usually begins years earlier, quietly, silently, progressively, and because the process develops slowly, many people normalize the warning signs. Maybe I'm just tired. Maybe I'm not drinking enough water. Maybe it's stress. Maybe the swelling will go away. But sometimes the body is signaling something much deeper underneath because kidney disease is really just a kidney problem. It is usually the final result of multiple systems slowly losing balance together. The pattern we commonly see. In clinical practice, the pattern often starts subtly. Blood pressure begins rising gradually. Blood sugar control worsens over time. Painkillers become part of daily life. Hydration becomes inconsistent. Follow-up visits are delayed. Meals become more processed. Physical activity reduces. At first, nothing dramatic happens. The body compensates. People continue working, walking, driving, living normal life, but underneath, the kidneys are already adapting to increasing strain. Then slowly, the body begins to change. Energy levels fall, leg swelling appears, urination patterns shift, sleep becomes less refreshing, appetite declines, concentration worsens, walking feels heavier, breathlessness appears more easily, and eventually the pattern becomes impossible to ignore. At that point, it is no longer random. It is a system under strain. What the kidneys are really doing. Many people think the kidneys only produce urine, but the kidneys help regulate fluid balance, blood pressure, electrolytes, waste removal, bone health, red blood cell production, acid balance, overall metabolic stability. So when kidney function begins declining, the effects spread everywhere. Fluid starts accumulating. Blood pressure becomes harder to control. Waste products remain in circulation. Weakness increases. The heart works harder. The brain becomes less sharp. The muscles fatigue more easily. And gradually, the whole body begins struggling together because everything is connected. The conditions quietly driving kidney damage. Now step back and look deeper at the systems commonly involved. Uncontrolled hypertension damages small blood vessels over time. Diabetes weakens the kidney's filtering units. Repeated dehydration reduces kidney circulation. Chronic infections create ongoing inflammation. Obesity worsens metabolic strain. Poor circulation reduces oxygen delivery. Excessive painkiller use quietly injures kidney tissue. And medication inconsistency weakens protection further. Then the cycle begins forming. High blood pressure increases kidney strain. Kidney strain worsens fluid balance. Worsening fluid balance raises blood pressure even further, and gradually kidney damage progresses. Another common pattern develops when diabetes damages the filtering system. Protein begins leaking into the urine. Scarring slowly develops, and kidney function declines progressively over time. Painkiller overuse creates another silent pathway. Reduced blood flow reaches the kidneys. Chronic injury develops underneath, and gradual decline continues quietly for years. Over time, multiple systems begin reinforcing one another. That is how kidney failure often develops, not suddenly, but progressively. The symptoms many people ignore early. Now look at the warning signs people commonly dismiss. Persistent fatigue, like or facial swelling, foamy urine, reduced urination, nighttime urination, poor appetite, persistent itching, muscle weakness, shortness of breath, mental slowing, difficulty concentrating, nausea. These are not isolated symptoms, they are connected signals, because when the kidneys begin losing balance, the entire body feels the effect. But many people delay evaluation because the symptoms seem small initially, and that delay allows silent progression underneath. Now bring in the nursing perspective. The nursing perspective, small daily habits matter. Kidney protection often depends on simple daily consistency, monitoring blood pressure regularly, staying hydrated appropriately, recognizing swelling early, observing urine changes, managing diabetes carefully, preventing infections early, maintaining movement and circulation, keeping follow-up appointments, avoiding prolonged dehydration during illness. Because kidney disease often worsens quietly when routines become inconsistent. And many people underestimate how much small habits protect long-term organ function. Now bring in the pharmacist's perspective, the medication risks many people never realize. This is where hidden danger often develops quietly. Many people use painkillers frequently for back pain, arthritis, headaches, body pains, without realizing that some medications gradually reduce kidney blood flow over time. Others mix herbal products, antibiotics, and over the counter medications without guidance. Some stop blood pressure medication once they feel fine. Others become inconsistent with diabetes treatment, and gradually, protection weakens underneath, not because treatment failed, but because consistency disappeared. As kidney function declines, medication safety also changes. Some medicines require dose adjustments, others may become dangerous entirely. That is why proper monitoring matters. The nutrition side of kidney protection. Now bring in the dietitian's perspective. Daily eating patterns quietly shape kidney health for years. High salt intake increases blood pressure strain. Sugary drinks worsen diabetes. Highly processed foods increase inflammation. Poor hydration reduces circulation. Excess alcohol stresses multiple organs together. Large portions worsen obesity and metabolic disease, and over time, the kidneys carry more pressure than they were designed to handle long term. But healthier patterns can also slow damage significantly. Better hydration, reduced salt intake, improved diabetic control, balanced meals, more vegetables and fiber, less processed food, reduced sugary drinks, healthier portions, moderated alcohol intake, small consistent changes reduce long-term kidney strain. Because prevention is far easier than managing advanced kidney failure later. Now step back and look at the full system. The blood pressure remains uncontrolled. Diabetes weakens filtration. Painkillers increase kidney stress. Poor hydration worsens circulation. Inflammation continues underneath. Diet fuels metabolic disease. Medication inconsistency weakens protection. And slowly, the kidneys lose their ability to compensate. Then, one day, the symptoms the body was hiding underneath began appearing more clearly: swelling, weakness, breathlessness, difficulty walking, loss of appetite, mental slowing. And by then, significant kidney damage may already be present because kidney failure rarely comes from one single issue. It is usually the result of years of accumulated strain across multiple systems. Final point: not every swollen leg is just aging. Not every tired body is just stress. Not every headache deserves another painkiller. And not every person with kidney disease looks obviously sick early on. Sometimes the body is struggling quietly long before symptoms become severe. That is why early evaluation matters. Simple blood tests, urine testing, blood pressure monitoring, diabetes screening, early lifestyle correction, because protecting kidney health early also protects the heart, the brain, mobility, energy levels, independence, and long-term quality of life. So do not ignore persistent swelling. Do not normalize constant fatigue. Do not misuse pain medications. Do not delay treatment for blood pressure or diabetes. And do not wait until kidney failure becomes advanced before taking action. Observe the pattern. Protect the system early. Because once severe kidney damage develops, recovery becomes far more difficult. For consultations, education, or medical guidance, PHI Preventive Health Institute. Call or WhatsApp +233 2800 and 720347.